Hello, my name is Laura Marks and I'm from Cook Medical. Today I have with me Dr. Karen Wu from UCLA. She's associate professor and also this year's president of the Southern California Vascular Surgical Society. Also is Dr. Kelley Hodgkiss-Harlow at Kaiser Permanente. She is the chief of vascular surgery and also this year's program chair for the Southern California Vascular Surgical Society. Welcome.
Thank you. Thank you.
Today, I'd like to ask you guys a couple of questions. We are celebrating March as Women's History Month and International Women's Day. And to do that, I'd like to highlight and have some questions for you as women in vascular surgery and the current update in the field that we're in right now. I'd like to start off with, are there ways in which women specifically can make an impact in the field of vascular surgery?
Well, as you know, Laura, women are definitely the minority in our specialty. That being said, we have female medical students, residents, and fellows who are all interested in or just starting their careers in vascular surgery. I think that having female role models and mentors to help shepherd as well as inspire greatness is extremely important. There are simply different priorities that come to light when female leaders and vascular surgeons have a seat at the table and participate in both the discussion of the issues as well as the solution. I truly believe that varied and diverse viewpoints are key to solving the issues that affect our specialty, both internally on a provider level and externally on a clinical care and patient level.
There are innumerable ways that women can make an impact in vascular surgery. In every aspect of vascular surgery, including leadership, education, mentoring, research, patient care, women inherently bring a perspective and approach that is distinct from men. And importantly, patients need to have the option of being treated by a woman vascular surgeon, if that's what they prefer. And students and trainees need to see women vascular surgeons in all roles to know that whatever their goals in the field of vascular surgery may be, that they are completely attainable.
Today, what positive changes are you seeing for female vascular surgeons right now? And then what changes are you looking forward to in this field in the future?
So even compared to when I was a fellow, which was a long time ago, I see significantly more practicing women vascular surgeons. And I also see more women vascular surgery trainees. I've seen a few more women in prominent leadership roles in vascular surgery, but I think that that is one of the areas where we still have a long way to go. We did not have our first woman president of the Society for Vascular Surgery until Dr. Freischlag in 2013. And to this day, she still remains the only woman president of the SVS. We didn't have a woman president of the Southern California Vascular Surgical Society until last year, until I became the president. So we still also have yet to have a woman editor-in-chief of the Journal of Vascular Surgery. And currently there are less than 10 women chiefs and chairs of academic vascular surgery divisions and departments in the US. My greatest hope is that in my lifetime, I will see equal representation of women throughout the highest ranks of leadership in vascular surgery.
I would definitely echo Dr. Wu's observations and comments, Laura. While I used to say one of the nice things about attending vascular meetings was there was never a line for the women's restroom, it's encouraging to see that dynamic changing, and the numbers are definitely increasing slowly but surely. Sadly, as Dr. Wu mentioned, there are even fewer female vascular surgeons in leadership positions, and the pertinence of this lack of representation cannot be understated. As the female representation in our specialty increases and evolves, so follows public perception. So personally, on a personal level, I look forward to the day when it's rare that a patient is surprised to find out or doesn't even ask if I am the actual surgeon, despite the fact that I'm female.
Excellent. Thank you both very much. So another question. So in a recent JVS article that was published in December 2020, the article was entitled Ensuring Equity, Diversity, and Inclusion in the Society for Vascular Surgery. And this was a report by the Society of Vascular Surgery Task Force on the equity, diversity, and inclusion. So in that article, they cite the definition of inclusion as involves authentic and empowered participation. What would, in your opinions, would you consider, what does authentic and empowered participation mean to you? And how would you like to see authentic and empowered participation brought to the forefront for women in vascular surgery? Dr. Wu, would you like to start?
Sure. So to me, authentic and empowered participation means enabling and encouraging everyone, men and women, to pursue their individual passions in the way, shape, and form that is meaningful to each person. So as Dr. Hodgkiss-Harlow mentioned, women in vascular surgery have different priorities, and I would like to see those differences celebrated rather than hindered. The accomplishments of women vascular surgeons, whether they be in leadership, education, mentoring, research, or patient care, must be respected and rewarded equally to those of men in all aspects, including compensation, leadership positions, accolades, speaking opportunities, and grant funding. I think that when we celebrate the differences that women in vascular surgery bring to all of those areas, we can only improve patient care and show all students and trainees that each person has an equal opportunity to accomplish their goals in the field of vascular surgery.
Excellent. Dr. Hodgkiss-Harlow, do you have an opinion on this?
Of course, I can't add a whole lot to what Dr. Wu just mentioned. She's much more articulate than me. But for me, authentic and empowered participation means being able to speak up and contribute in public forums without fear of censorship, bias, or recrimination. In addition, feeling as though our work and opinions have inherent value and are recognized on par with all other gender and ethnic groups.
I have another question. As a representative of the Clinical Programs Division in Cook Medical, what can be done to change the underrepresentation of women in vascular disease studies? Talking about a little bit about the gender disparity and understanding and the approach to vascular disease management.
Well, I mean, I would say even such a small thing as decreased enrollment of women in clinical trials, which if you look at any clinical trials, that's what you'll see. This could be positively impacted by having women in leadership roles. It has been shown that patients have greater degrees of trust in physicians that look like them. So women patients may be more likely to participate in a trial when they're approached by a woman investigator.
That's interesting. Very interesting. Dr. Wu? Oh,
I completely agree. We've come to recognize that much of the data that we have garnered from previous vascular disease studies have been obtained disproportionately from men study participants, and that women may not have the same outcomes after vascular disease treatment as men. As Dr. Hodgkiss-Harlow said, having more women in leadership roles and participating as investigators can likely increase the representation of women in vascular disease studies. However, willingness to participate in vascular disease trials in and of itself is an area that requires more investigation. And I think that having more women investigators who have different priorities and different interests than our previous men investigators, and who may be more likely to be invested in understanding and improving the patient experience of study participation, will contribute to improving representation of women in vascular disease studies.
Thank you. And look forward to the future.
So do we.
Thank you very much, Dr. Hodgkiss-Harlow and Dr. Wu, today for your time and your perspectives on women in vascular surgery. Congratulations to your roles in the upcoming Southern California Vascular Surgical Society meeting and participation. I do hope it goes very well.
Thank you.
Thank you.